everyone. We are now in the third piece of our axial skeleton lecture, and we're going to be talking about the vertebral column. The vertebral column includes the vertebrae, all stacked on top of each other, the sacrum, and then the little tiny tailbone at the end, the coccyx. When the vertebral column is all put together, it creates regions, and these regions have a corresponding curvature. Okay, so the first off, when I say the word cervical, what does that mean to you? Hopefully at this point you remember your anatomical region terms, and cervical means neck. Okay, so those are going to be the vertebrae in the neck region. What about thoracic? Where's thoracic? Thoracic means chest. Okay, so those are going to be the ones in the chest region. The word lumbar means lower back. So I like to think of like you have a chair and they talk about lumbar support. It just means supporting this lumbar curvature of the vertebral column. Okay, so lumbar means lower back. And then sacral just means it's in the sacrum. Okay, so it's not really a vertebrae, it's the sacrum. And the sacrum is different because they are made up of fused vertebrae. So instead of being isolated, they're all in one kind of big clump here. But you can see how they look kind of like vertebrae, but they're all fused together. That's the sacrum. And then the coccyx is this one right here. And the coccyx is also fused vertebrae, and there are 4 of them. Okay, so that's the little tailbone that would sit right here on the sacrum. Okay, so let's look at how many of each. So here we have the cervical curvature with the cervical vertebrae, the thoracic curvature with the thoracic vertebrae, the lumbar curvature with the lumbar vertebrae, and then the sacral curvature that's created by the sacrum and the coccyx that sticks to it. Okay, so when we look at the cervical, there are 7 cervical, 12 thoracic, and 5 lumbar. And the way that I learned to remember how many of each was that they're common eating times, right? So you have breakfast at 7, you have lunch at noon, and you have dinner around 5. Now, I don't know if you necessarily eat like that, but that's just one way to remember it. 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. Okay, so let's also talk a little bit about some pathology. So when you put the vertebral column in place, you do have anterior and posterior kind of curvatures. Okay, see the curvature here. But if you have curvatures laterally, okay, so off to the side where it's not supposed to. So for example, right here, that is called scoliosis. And there are kind of abnormal curvatures, anterior and posterior. For example, if your stomach kind of sticks way out and your back kind of sways in a lot, it's called lordosis, usually caused by things like pregnancy or sometimes being overweight. But what I'm talking about is scoliosis, and scoliosis usually happens around ages 10 to 20, so usually during sort of earlier development, so in your teen years. And the good news is if you catch scoliosis soon enough, you can correct it fairly easily, and I say easily, but they would have to wear a brace. Braces are usually typically pretty effective, they just have to be worn consistently. And, you know, I understand that could be hard when you're a teenager, but catch them early and you can get them fixed before they get worse. Okay, so let's look at some general bone features that are found for all of the vertebrae. So I'm just going to choose one here. So this is actually thoracic vertebrae. I'll tell you how to figure that out, how you know that in a little bit. Let's look at some of the structures that we found for all of them. Starting with this one here. This is the one that's going to stick out in the back. Okay, looks like this on this one. It's going to stick out. So when you see somebody's back and the little kind of points in a line along the back, what you're seeing are the spinous process sticking out. Okay, so the spinous process, are they going to be on the anterior side or the posterior side? The posterior side. And the way I kind of remember that is your spine's on your back, right? So the spinous process will stick out posteriorly, And so that'll be the very, very back of your body. Okay, so that's the spinous process. This is another spinous process. And then off to the side, these ones are called transverse process. Why are they called that? What is the word transverse related to? Again, back in week 1, I told you all these words are coming back. So transverse means off to the side. Okay, so remember this is the transverse plane. Okay, so it's like that, cut like that, right? So the transverse off to the side like that, kind of horizontal line right there. So these right here, the ones that are coming off to the side, those would be the transverse process right here, transverse process there. Now, another thing that you should notice is all of the vertebrae are going to have a big hole in the middle. What was the word, the general term for hole? Foramen or foramen, again, however you want to pronounce that. Okay, so this right here is a big hole in the vertebrae. So this right here is going to be the vertebral foramen. Okay, the vertebral foramen. So what would run right down in that vertebral foramen? That's going to be where you're going to have the spinal cord. Okay, so when they all stack up on top of each other, all of them stack nice and neatly so that they all are the same kind of plane. And running down the middle, that creates the cavity, and that cavity is the vertebral cavity. And running in the vertebral cavity, that's where your spinal cord is going to run. And then as they stack together, they also stack, oh, I wish I'd brought in one that matched with it. They also stack nice and neatly so that, see this little notch right here? That's going to be 1/2 of the whole. Okay, so this little notch right here is going to line up so that there's a little notch on the other side, and that's going to create one full complete hole. Okay, so the hole in the very, very middle there, that's going to be the vertebral foramen, but the hole that's created when they're stacked up on top of each other on the side here, that's going to create what's called the intervertebral foramen. Okay, remember, inter means between. Okay, so it's between two vertebrae, and that's going to be important because the spinal nerves that we'll talk about when we get to the nervous system, those are going to exit at that point. Okay, that is the intervertebral foramen right there. Okay, also between the vertebrae, so on their bodies, this is the body. Oh, I should have mentioned that. This part right here is the body. Between the vertebrae, that's going to have a little fibrocartilage pad right there, and that's called the intervertebral disc. Again, inter means between, so the disc between the vertebrae, it's going to be made out of fibrocartilage, so it's nice and cushy. And even more than that, in the very center of it, it has this gelatinous mass that's called the nucleus pulposus, the nucleus pulposus. And what that does is that creates a little bit more cushion so that you can get quite a lot of movement, and it prevents compression due to gravity and all of that, right? So that's going to create this nice, wonderful articulation joint between the vertebrae. Okay, so we talked about the spinous process, transverse, off to the side like the horizontal line, transverse process, the vertebral foramen, and the body here. Now there's two more I want to talk about. So creating that vertebral foramen, you create an archway. Okay, so this is called the vertebral arch, and the vertebral arch has two parts to it. You have the pedicle. What does ped mean? Ped means foot-like, or base, or bottom. Okay, so that's going to be this part right here. So it only includes this part right here that's kind of stocky and kind of circular. That's the pedicle. And then this area here, the other part of the arch, is going to be created by the lamina. Now, a lamina means thin plate, okay? Thin plate right there. So that is the lamina, the thin plate, just this part right here. And the pedicle is the foot-like base at the bottom of the arches. And that's going to come together to create that hole, which is the vertebral foramen. Okay, so all of the vertebrae are going to have these general features no matter what region they are from. Okay, Okay, talked about these things. Okay, so now let's start talking about, well, how can you distinguish between the three different regions for the vertebrae? Let's start with the cervical vertebrae. Okay, have one right here. And for the cervical vertebrae, before I show you anything else, hopefully something pretty big jumps out at you. What does this have that this one does not? Okay, so they still have the spinous process, they still have the transverse process in the body and the vertebral foramen, all those things. What does this one have that this one does not? Hopefully you'll notice that right here, this one has, instead of one big hole, it's got 1, 2, 3 holes. Okay, and that's because the cervical vertebrae have 2 additional holes, and those are called the transverse foramen if it's singular, if you're just talking about one of them, or the transverse foramina if you're talking about both of them. Okay, so only the cervical vertebrae are going to have 3 holes. If it doesn't have 3 holes, then it is definitely going to be one of the 2 other regions, either lumbar or thoracic. Okay, but if you see 3 holes, that is going to be a cervical vertebrae, and that cervical vertebrae has those extra holes because they're going to be passageways for some blood vessels. Okay, so the blood vessels will pass through those extra holes, which are the transverse foramen. Okay, transverse foramen, because foramen means hole. So 3 holes, cervical. Now, for the cervical vertebrae, we also have some very special ones that I want to talk about. And the first one is this one here. This is the atlas. The atlas is your very first cervical vertebrae. That's what C1 stands for. But for lab, make sure you write if this is on your lab practical, make sure you write the word atlas, not C1, please. Okay, so this right here, this is the very, very, very first cervical vertebrae. Okay, so let's talk about where the name comes from. Who is Atlas? Atlas is someone that comes from mythology. It's a story. Atlas is the guy who holds up the world. So this right here is Atlas. What world do you think it holds up? Your skull, right? This is your world right here. Okay, so Atlas is the very, very first cervical vertebrae, and it's going to hold up the globe, which is the skull. Okay, so that's where that name comes from. Atlas is the one that holds up the skull. Okay, so when we look at Atlas, you do need to be able to recognize and identify Atlas. And what I want you to do right now is let's look at this one right here. So yes, it's still cervical, so it still has 1, 2, 3 holes, 1 vertebral foramen and 2 transverse foramina. But what is missing? Okay, still has a spinous process, not quite as pronounced, but it's still there. Still has transverse process, but what does it not have? What was this part here called? That is the body. Okay, so to me, the most distinguishing characteristic of the atlas is it does not have a body, no body. So if you see a picture of a vertebrae with no body, it has to be the atlas. All of the other vertebrae have a body. Okay? Okay, so when we look at this here, we would still have the transverse process that's right there. Okay, so this is the atlas because it holds up the globe. Underneath that, the second cervical vertebrae also has a special name because it also has a special structure that none of the other vertebrae have. And that's this part right here. Okay, so this bone right here, this is called axis. So the second cervical vertebrae is called the axis. Now, what is an axis? Okay, so if you think about like the world, the earth, spinning on an axis, that just means that it has a line down, you have a point in the middle that it spins around. okay? So this right here is called the axis because it has an axis that everything else spins around. Okay, so when we put them together like this, here's the atlas there. Oh, I have it upside down. Here's the atlas there. And so when they articulate, this allows you to pivot. Okay, so this structure here that forms the axis, this is called the dens. This is the dens right here, just the part that sticks up. Okay, so this region, just this part right here, that's the dens. And that's going to articulate with the internal structure on the atlas and allow you to have a pivot motion. Okay, so the axis allows you to shake your head, no. Okay, so that allows a pivot joint, which just means it's going to rotate along an axis. Okay, so the axis would be the dens of the axis, and that allows the atlas, which is the first one, to pivot around it. Okay, rotate your head like this. And that's where they're special.